Newsfirst, Newsline.
Hello there, a very good evening and welcome to another edition of Newsline, coming to you live and direct from our Newsfirst studios here in Colombo. Our guest this evening, Professor Indika Karunathilake, the immediate past president of the Sri Lanka Medical Association and the vice president of the Organization for Professional Association. A very good evening, sir, and welcome to the show.
Good evening, Sharlan.
Professor, I believe your presence here on Newsline is quite timely, as tomorrow is the day that the first batch of vaccines will arrive in Sri Lanka. Now, a few days ago, it completed a year for the COVID-19 the virus being present here in Sri Lanka, and here we are a year down the line. We have a vaccine, but does this mean the end of the preventive measures that we've been taking so far?
Yeah, I think very important question. This is a very good news that the vaccine is there and vaccine will be available for Sri Lankan. It's a very good news indeed. However, one thing that we need to realize is vaccine is among the very important tools in controlling this epidemic. But this is not the only tool and it is not a replacement. It's an essential tool, definitely it's essential. But it will not be a replacement for the basic preventive measures that we need to follow. That's the contact tracing, isolation, and the physical distancing, the hygiene. All this has to be maintained. It's definitely not a replacement, but a must addition.
Well, Professor, for the benefit of our viewers out there, is this COVID-19, there are various views being expressed regarding the efficacy of these vaccines. There are figures that are being presented. Some say they're 90% efficient, some say they're 70% efficient. Different vaccines have different efficiencies. When we speak about a vaccine, how really does the vaccine for COVID-19 work?
Yeah, again, yes. Again, very important, because I think we have to very clearly understand how this works. Now, there are many types of vaccines that have been developed, and among them about 4 or 5 has been shown to be successful based on the evidence that is available. Generally, how these vaccines works is, if I may explain, if you can visualize the COVID virus, SARS-CoV-2, which looks like a rambutan fruit with the spikes.
I believe everybody is familiar with the shape of the virus.
Very familiar, with spikes jutting out. Those spikes are actually protein molecules, spiky protein molecules. That is where the story lies, because with these protein molecules, the virus can attach to the cell surface of the human respiratory tract and then get into the cells.
Right.
So this is where the virulence and everything depends on the virus. So how these vaccines work is that they train the human immune system to fight against this virus.
Right.
Again, if I am to explain, these vaccines work in 2 main different ways. But in generally, what happens is, once the vaccine is entered to the body, vaccination is done, it triggers off a biomolecular reaction that will produce these molecular proteins.
Right.
Then our immune system is trained to identify these enemy proteins and attack them.
Right.
So what vaccination does is triggering off this process and training our system. So when the next time when the actual virus enters, then our immune system cells can identify that virus with those spiky proteins and attack them.
So anyone who has received the virus, is there a chance of them contracting the virus anyways, despite the fact that they have received a vaccination?
Possible.
If someone has received the vaccination?
Possible. Yeah. One thing is that to get the full immunity, you need 2 doses for most of the vaccines. Generally about 2 to 4 weeks apart. The vaccine that is coming to Sri Lanka is 4 weeks apart. That is one reason, because you need to, it takes time to develop the full immunity.
Right.
Other thing is, this immune process of these attacking antibodies starts only when the virus is within the cells. But before entering the cells, the virus starts colonizing the nasal cavity.
Right.
At the moment, there is no evidence that can be prevented. So it is possible for someone, it may be possible to someone to transmit even when having the vaccination.
Of
And
course.
it may be possible to have the asymptomatic milder infection
Right.
even after having vaccine, because we are working on very limited data. What this data says is it is 70% or 90% efficacious in preventing the severe disease or the mortality.
Right.
Yeah.
So a person could still be a carrier of the virus and maybe infect another person who is weak and who hasn't been vaccinated as yet.
That's the thing. There's no 100% guarantee that it will prevent the asymptomatic transmission.
Well, of course, our viewers out there might be having many questions, and you can send those questions in to the number that will be displayed on your screen. Moving to one question that has already been sent in. Now, there were concerns raised regarding allergic reactions. What sort of after effects would the vaccine have? The question that has been raised is, are there any allergic reactions that could surface from taking the vaccine? There are specific problems here, including thyroid problems or taking any other medication. How is the research regarding that front, especially on the virus that's coming to Sri Lanka, on the vaccine that's coming?
Yeah, so the vaccine that is coming to Sri Lanka probably tomorrow is what we call the Oxford AstraZeneca vaccine, initially developed with the Oxford University and the AstraZeneca collaboration.
Right.
And it is the same vaccine is reproduced in India in the Serum Institute, which is the one of the largest vaccine producing organization in the world. So it's the same one but produced in India. That is what's coming to Sri Lanka. If you take any drug or any vaccine in that case, there can be allergic reactions. So here also, when the vaccine is entered the body, it comes with maybe some other molecules. So it's possible for some people to have reactions. So it may be possible for some to have fever, mild fever, but generally most of the reported ones are mild reactions. There are some serious reactions also. It's possible because when this kind of very large scale vaccination takes place within the world within very short time, it's possible to get some reports. Yeah, and at the moment the percentage of the adverse reactions seem to be higher than what is generally seen in a vaccine program, but again the data and evidence is not adequate within this very short time. What we have to say is possible. So if you have any of those conditions, it's always better to get the medical advice.
Right. Also, Professor, speaking about the inoculation program that will be launched in Sri Lanka, there have already been announcements made that there is a priority list that has been drafted out. First responders, military personnel will be the first to receive the vaccine, and currently the position of the government is that private importing or for private hospitals to import this vaccine, that will not be allowed. Speaking on the inoculation program that has been set in place in Sri Lanka, of course, you're the immediate past president of the Sri Lanka Medical Association. Based on the data that you have been privy to, how is the program like?
Yeah, so you are correct. The decision of the authorities. Here we have to go by the decision of the experts, and it has to be an essential technical decision. One thing we have to remember and understand is Sri Lanka as a country have a very well established immunization and vaccination program. A program that has been there for maybe last 40 years. It's a very strong program. So the country and the Ministry of Health and the health personnel, they are very experienced in this process. So the decision, I think, should be left to the expert bodies like the Ministry of Health and the virologist and immunologist and the technical bodies that were established, and also the epidemiology unit. And as far as I know, epidemiology unit has a very clear plan of how this this vaccine will be deployed.
So there are already established protocols for this?
Yeah. So like you said very correctly, initially it will be health professionals. So the thing is, it's not possible to vaccinate everyone in the country at one go. I mean, ideally, if you are to reach that, what we call the herd immunity, you need to vaccinate at very large scale, maybe to go up to say 80% or over.
And does this vaccination need to happen in a short period of time?
Can you come again?
So, to develop herd immunity, does that mean that 80% of the population must be vaccinated during a short period of time, or the time factor isn't really relevant?
Not necessarily, within a reasonable period of time, but practically it will not be possible anyway. To reach that 80% within a short period of time. That's why even the developed countries or the most affluent countries, they go for, say, stepwise vaccination process. Even countries like Australia, who might go for 100% vaccination, are doing it in a stage-wise process. So Sri Lanka is the same, and probably it's a correct decision because the health professions are the highest risk. So the current decision is to start with the health professions, and the deployment plan is clearly demarcated by the epidemiology unit, and it will start very soon.
Well, there are a number of vaccines that have been produced. There's one, the Sputnik 5 vaccine in Russia, then you have the Chinese vaccine, the Indian vaccine. Some people might be wanting maybe a vaccine from a certain country, maybe some depending on their preference. So with regard to the differences between these vaccines, are they extremely different or are they more or less the same?
Yeah, again what we have to say is it's too early to compare. Now, like you said, some say about 90% efficacy or 70% efficacy, but those are also conducted within very limited restrictions within those different countries and maybe by the companies themselves. So it is like trying to compare apples and oranges. So what we can say is there are some vaccines which are reasonable, and efficacy is not the only factor. There are many other factors like the safety, the cost effectiveness, feasibility. For example, the Pfizer vaccine, it needs refrigeration of say -70 degrees, which may not be possible in Sri Lanka to maintain that cold chain. But the Oxford AstraZeneca is more reasonable in that sense. So there are so many factors that you need to consider before deciding which vaccine is more appropriate for a particular country. Again, I think it's a decision best left for the experts.
So the United Nations, I beg your pardon, the World Health Organization is also due to provide a certain batch of vaccinations for Sri Lanka under the COVAX facility.
Yes.
So what will this vaccine be and how soon will it be in Sri Lanka?
Yeah, so yes, the World Health Organization also working in collaboration with another alliance called Gavi, that is again related to vaccine and immunization, and their basis is that there should be equity in distribution of the vaccine, because there was a trend that more affluent countries wanted to get the vaccine and they were trying to purchase in bulk, but ultimately if you think about the public health response, it doesn't work in that way. Because this doesn't mean, it won't be effective only the affluent people or only affluent countries get the vaccine, because if others haven't got it, they will get the infection, and the affluent countries or the affluent people are also not safe. So based on this public health principle, because if you are to reach herd immunity, equity in distribution is a must, and you have to focus on the high risk population. So that is why the World Health Organization with Gavi, they have started this collaboration called COVAX, and their target is to provide vaccines to the countries which will be difficult to purchase, maybe in a concessionary rate or sometimes maybe free, depending, and then ensure equity in distribution. So it's a very good move, and as far as I know, they are working on that.
So around when will these batches of vaccine from the World Health Organization arrive in Sri Lanka?
Yeah, again, we cannot give exact times, but they are planning to maybe within few months' time and towards the end of this year. Like that's the information that is available with the fact sheets that are available. So plan is to spread it out within maybe few months towards the end of this year, to cover many countries.
Professor, before we cross into a short commercial break and get back into the discussion regarding what the future course of action should be in Sri Lanka and how the program and how the people of this country should conduct themselves during this very sensitive period, how long do you think it will take for the inoculation program in Sri Lanka to reach a substantial level, or for Sri Lanka to reach herd immunity?
Yeah, I think it's too early to talk about herd immunity,
right?
Because anyway, it's going to take substantial time, and answer how long, that also depends on how and when we'll be getting the other batches of vaccine. Now we have received the first batch, but that also you need 2 doses. Because to reach the immunity, say if you have got say a consignment of say 300,000, then maximally it would be 150,000 that could be vaccinated.
Right.
And there could be some wastage also, no. So with that, it would be little less than 150,000 that could be vaccinated, just hypothetically. So same with others also. So it depends on how we will be receiving other consignments, and we depend a lot on COVAX, I think, because that could be a very reliable
facility.
Facility to depend on. Yes.
Right. So once we come back after this short commercial break, we will discuss on the role of the general public in responding to this situation, the arrival of vaccine, and of course the inoculation program here in Sri Lanka. And also you will find answers to the questions on, has the number of cases in the world begun to reduce after the inoculation programs have begun? Stay tuned. You're watching Newsline Live.
Newsfirst, Newsline. Newsfirst, Newsline.
Welcome back to Newsline Live. We're in discussion with Professor Indika. Professor, you are the immediate past president of the Sri Lanka Medical Association. Your time at office came to an end at a very important time here in Sri Lanka when the vaccination programs are just about to begin. Now that you are out of office and your successor has taken over, does that mean the end of the road for your contribution into the program to control COVID-19 here in Sri Lanka?
It was actually a privilege to lead the National Medical Association during that crucial time period and year. However, having said that, I don't think the role should come to end there, because one reason is even though I'm the immediate past president, still I contribute to the decision making process as a council member and immediate past president.
Right.
And also I serve as the vice president of the organization of the Professional Association, and also internationally the leading public health association in this region, that's the Asia Pacific Academic Consortium. There also I am the vice president. So there's a reasonable role to play both nationally and internationally. And more than that, 1 year ago none of us knew much about COVID-19, but within this 1 year, after in-depth work and involvement, we have gained very good insight and in-depth understanding about this situation.
Right.
I think it's my responsibility to share that understanding.
Professor, my next question to you is a question that we've been grappling with for quite a long time now. Is the COVID-19 pandemic here in Sri Lanka in community spread?
All right, I'll answer it in this way. At the moment, a lot of patients are found from the community, not only from Colombo but from other districts also, mainly from the crowded, congested areas with poor ventilation. Many patients have been found.
Very urbanized areas.
Very urbanized areas and crowded areas, and around 400 to 500 patients are found every day. What I would say is it's a very serious condition which we need to bring under control. However, patients being found in the community doesn't mean community spread. Community spread is a very highly technical definition, which is defined by the World Health Organization. Recently also they have changed the definition. However, having said that, I would say better to leave that declaration of community spread to the experts. The reason why I am telling is, once this declaration is made, then you have to change your strategy completely. So far, Sri Lanka has been successful in doing the correct thing in the correct way. For example, the contact tracing, isolation, testing, rationalized testing, treatment, all these things. However, if there is real uncontrollable community spread, no point of isolating because anyway people are there.
Right.
No point of contact tracing because you can't trace them. That means you have to change the strategy and move towards hospitalized care.
So you need to change from a preventive strategy to a
more towards
post-care.
curative, because if the
Right.
patients are coming from the community in an uncontrollable way, then there is no point of trying to control. But I suppose what the authorities are trying to is trying their best to control, and I suppose that is what should be done.
Well, there has been a spike in the number of cases. Initially, we had less than 100 cases when the COVID-19 vaccine, pandemic just began. Recently, the trend increased exponentially, especially after the second wave hit. There were over 500 cases that were reported daily. Now, the cases are over 800 marker almost every day, with a majority of those cases, sometimes over 50%, being reported from Colombo, the financial hub of the country. So, how dangerous really is this?
Yeah, I suppose it's very serious, because as you would remember, in last year around say April or June, July, the situation was very much under control.
Right.
And suddenly I suppose we have lost the focus. Initially, the country was on the correct path there, following the correct principles, listening to the experts, and following the basic preventive public health approach. The country was doing very well. But suddenly, the focus, the attention has deviated from what we should have been focusing. I mean, even right now, the vaccine will be there tomorrow. But before that, the country, we should have been preparing the country for the vaccination, the mindset, understanding what we expect, and the importance of public health measures. That should have been the approach. But unfortunately, what we have seen was the attention was diverted. And I don't think we can blame one party or a person or people for that, or even general public. I think all of us are responsible for that very serious diversion from what should have been done. I think it's time to bring back the focus.
Professor, now we're speaking of the vaccine that's coming tomorrow. We're in the final few minutes of this show. So just before we wrap up, we're speaking of the vaccine coming to the country tomorrow. There are also a number of local kind of products or food supplements that are being promoted as a cure or a supplement for the COVID-19 pandemic here in Sri Lanka. What should the general public really be focused on at this very timely and very decisive juncture here in Sri Lanka in the control of the COVID-19 pandemic in the country?
Yeah, I mean, people would generally go for what is more attractive and what seemed to be kind of convincing. So that's why I initially also mentioned that we have lost the focus somewhere down the line. We should have been really focusing on giving the correct message and giving that message in an effective way, the way that people will be following, because those simple messages like physical distancing, cleanliness, and ventilation, they are not very attractive. But the magic treatments are very attractive. So all of us have a responsibility to make sure that we keep the right focus. So maybe we have deviated, but at least now we should focus. So that's a danger, because when you bring attention or divert the attention to these kind of unproven or unsubstantiated methods, we are basically pushing people towards that. We should not have done it.
So the COVID-19 inoculation program that will begin tomorrow, are you hopeful about it?
Very much hopeful. Yes, I mean, that's an essential tool. That's an essential tool, and we should be looking forward to it, but very clear understanding that this is only an important tool. This will never be a replacement. This will never be a replacement for the basic public health approach. Only if all these factors comes together, then only the condition will be controlled. Because as I have mentioned previously, the vaccine has been shown to be efficacious in preventing the serious disease, symptomatic disease or mortality. At the moment, evidence related to preventing of asymptomatic transmission is lacking. So this alone is not enough. This is required, essential, but it has to be coupled up with a stronger, even stronger, because even if you take the vaccine, that doesn't mean that you can basically neglect the public health measures.
Thank you very much, Professor, for joining us on our show and educating the general public regarding the measures. And you heard it from the Professor. We need to continue to adhere to the COVID-19 guidelines that have been issued by the authority, the experts, social distancing, simple things like washing your hands and wearing a face mask, even to that matter, are going to continue to be relevant, even though the COVID-19 vaccine will be in Sri Lanka soon. Thank you very much once again, Professor.
Thank you.
And thank you very much to all our viewers out there for tuning in. Of course, we will see you again, same time, same place tomorrow. Until then, take care and God bless.